Benzocaine is a local anesthetic used to temporarily relieve pain from minor mouth problems such as toothaches, canker sores, sore gums, sore throat, or mouth and gum injuries. It works by numbing the painful area. However, it is important to note that this product should not be used for children younger than 2 years old due to the risk of serious side effects. It is best to consult with a doctor for more details about the appropriate use of Anbesol Gel. When using Anbesol Gel, it's important to follow the directions on the product package or as prescribed by your doctor. Do not use this medication more than 4 times a day unless directed by your doctor, and allow the medication to stay on the painful area for at least 1 minute before spitting out or rinsing the mouth. It's important to avoid getting this medication in the eyes. If your sore throat is severe or lasts for more than 2 days, or if your sore mouth symptoms last more than 7 days, or if you have a fever, headache, rash, swelling, nausea, or vomiting, it's important to stop using this medication and tell your doctor. This could indicate a serious medical problem that may require different treatment. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. When using Anbesol Gel, you may experience slight burning, tingling, or stinging. If these effects persist or worsen, it's important to seek medical advice. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of potential side effects. Most people using Anbesol Gel do not experience serious side effects. In rare cases, this medication can cause a very serious, possibly fatal blood disorder called methemoglobinemia. This is more likely to occur if you have breathing problems, certain blood diseases, or if you are a smoker. Symptoms of this disorder may occur within minutes to a couple of hours after using the medication. If you experience symptoms such as pale/bluish/gray skin, unusual tiredness, shortness of breath, fast heartbeat, dizziness, headache, or confusion, stop using the medication and seek medical help immediately. While a very serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. As for the optimal timing of taking Anbesol Gel, it should be used as directed by your doctor or as needed for relief of pain. Be sure to follow the dosage instructions provided with the medication. Before using Anbesol Gel, make sure to inform your healthcare provider if you are allergic to benzocaine or other cane anesthetics, or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions. If you have certain health conditions such as heart disease, certain blood disorders, or breathing problems, consult your doctor or pharmacist before using this product. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using. If you are pregnant, use this product only when clearly needed and discuss the risks and benefits with your doctor. It is not known if this product passes into breast milk, so consult your doctor before using it while breastfeeding. Remember, always consult your healthcare provider before using any medication. When using Anbesol Gel, it's important to be aware of potential drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone else has taken too much Anbesol Gel and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, seizures, and irregular heartbeat. Make sure to keep all your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. Anbesol Gel is a topical anesthetic that is used to relieve pain and discomfort caused by canker sores, cold sores, fever blisters, and minor dental procedures. It works by numbing the affected area to provide temporary relief. This gel is usually applied to the affected area of the mouth or gums, and it can be used as needed for pain relief. It is important to follow the recommended dosage and not exceed the maximum daily dosage to avoid potential side effects. It is best to apply the gel at the first sign of discomfort for the most effective relief. When storing Anbesol gel, make sure to keep it at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom, and always keep medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless directed to do so. Instead, properly discard it when it is expired or no longer needed. If you have any questions about how to dispose of Anbesol gel, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.